this is only the Northern Cape. People are moving around, families are going to Johannesburg, to Durban, all around the country, and we don't have the ability to track them all. So we're in desperate need of a national database, and we're in desperate need of more family colorectal cancer nurses, because as you find a new family, this just increases exponentially. 5 years ago, we were doing 5 to 6 scopes in Uppington. Now we're doing 35 to 40 scopes. So, it's a bit, the more you dig, the more you find, and, who knows what's going on in the rest of the country. But, so I think for us, the critical thing would be looking at expanding this and trying to get some kind of national platform, to run it out of 4 filing cases in an office at Grooteskier is becoming a bit of a challenge.
In this particular group of people, when you compare those individuals with a mutation who have chosen to enter a screening program versus the family members who've said, and are mutation positive, have said, no, I don't want to do this, those who enter the screening program gain at least an additional 20 years of cancer-free life. So that to me makes it all worthwhile. If we can avoid cancers, then there's a reduction in the use of chemotherapy in areas like this where it's hardly available. And the mortality from symptomatic colorectal cancer in this area is extremely high because access to medical care is limited, extremely limited.
Half the households in this country are led by women. Their men are not there. They've left. Why with their children? And that, is taking that woman away from her children is difficult. That's one of the reasons why we get delayed in access. I mean, we've done research studies on how patients delay, where's the delays in the system. We've looked at these things, but because women have to look after their children, and often there's no one to take care of their children. If they leave the house to go away 100 kilometers or 200 kilometers, or even just down the road sometimes, someone needs to look after the children. So the closer you can get to them, the easier it will be for them to actually access the service. And that's what it is. That's how you can improve early diagnosis, is by give them easier access. I mean, they will have to leave then and go somewhere at some stage during their treatment. They will need to go away to a hospital where they can get access to the services. But that initial step is like, you don't want that sort of, if you ask patients, that's part of our history taking, we ask them, how long has the lump been there? And often they're aware of it for 6 months longer. And it's just that sort of initial step. So, I mean, it's us also teaching. The breast awareness in this country is not where it should be. People should know what is the symptoms to look out for. I mean, patients often tell me they've got a lump, it's not painful, doctor, so I don't worry about it. And that sort of misperception needs to be, that is sort of, breast awareness needs to be upped. I mean, it is part of the National Department of Health's plan to increase, we've sat down and we've made these, protocols and what needs to be done. And it's all on paper, and it makes absolute sense on paper, but implementing that is the problem.
And because of all of this, additional funding would really mean the world to us and to our patients.
PinkDrive has been successful in South Africa with little funding. But with this funding, we will grow exponentially. And we will be able to help more people on a daily basis. It is a known fact that more women die on the African continent of breast cancer than any of the other cancers. And the more women we save, the less orphans we're going to have, and the less burden on the state, which already cannot deal with the orphans they've got.